Question 1. What factors determine the most appropriate and ethical course of action for a credentialed alcoholism and substance abuse counselor, CASAC, when a client who has maintained sobriety for an extended period discloses a recent relapse? Option A. The CASAC personal opinion on the client's character and the perceived severity of the relapse based on anecdotal evidence. Option B. The client's willingness to engage in a revised treatment plan. The CASAC assessment of the immediate risks to the client and others, and the client's expressed desire for continued support. Option C. The CASAC immediate obligation to report the relapse to law enforcement and the client's employer, regardless of the client's consent or the presence of imminent danger. Option D. The CASAC caseload capacity and the availability of alternative treatment facilities, without direct consultation with the client about their needs. Correct answer is B. The client's willingness to engage in a revised treatment plan, the CASAC assessment of the immediate risks to the client and others, and the client's expressed desire for continued support. Explanation. Scenario analysis. This scenario presents a common yet ethically complex situation for a CASAC. A client who has been sober for a significant period reveals a recent relapse. The challenge lies in balancing the client's immediate need for support and intervention with the CASAC ethical obligations to maintain confidentiality, promote client autonomy, and adhere to professional standards of care as defined by New York state regulations for CASAC. The CASAC must navigate the client's disclosure, potential risks to the client and others, and the need for a revised treatment plan without violating professional boundaries or legal mandates. Correct approach analysis. The correct approach involves acknowledging the client's disclosure, validating their experience, and collaboratively developing a plan to address the relapse. This aligns with the New York State education law and the regulations governing CASAC practice, which emphasize client-centered care, the importance of a comprehensive assessment, and the development of individualized treatment plans. Specifically, 14 NICR Section 360, 5 Treatment Planning, and 14 NICR Section 360. 6. Client rights underscore the need for client involvement in treatment decisions and the provision of appropriate services. The CASAC role is to facilitate the client's return to recovery, which may involve reassessing their current coping mechanisms, identifying triggers, and potentially adjusting their treatment plan to include relapse prevention strategies. This approach respects the client's autonomy and promotes a therapeutic alliance built on trust and open communication. Incorrect approach is analysis. One incorrect approach would be to immediately report the relapse to external authorities without a thorough assessment and discussion with the client. This violates the principle of confidentiality, a cornerstone of CASAC practice as outlined in 14 NICR Section 360. 6. Client rights. Unless there is a clear and imminent danger to self or others, which is not indicated in this scenario, such a breach erodes trust and can deter clients from seeking help in the future. Another incorrect approach would be to dismiss the relapse as a failure and terminate services without offering further support or a revised treatment plan. This is contrary to the ethical imperative to provide ongoing care and support for individuals in recovery, as mandated by the principles of beneficence and non-maleficence inherent in the CASAC Code of Ethics and reflected in the regulatory framework's emphasis on continuity of care. It fails to recognize relapse as a common part of the recovery process and neglects the CASAC responsibility to help the client learn from the experience. A third incorrect approach would be to offer advice or solutions without first conducting a comprehensive assessment of the relapse. This bypasses the crucial step of understanding the contributing factors and the client's current state, as required by 14 NICR Section 360. 5. Treatment planning. Effective intervention requires a nuanced understanding of the individual situation, not a one-size-fits-all solution. Professional reasoning. When faced with a client's disclosure of relapse, a CASAC should employ a structured decision-making process. First, actively listen and validate the client's experience, creating a safe space for disclosure. Second, conduct a thorough assessment to understand the circumstances of the relapse, identify triggers, and evaluate the client's current risk factors and coping strategies. Third, collaboratively develop a revised treatment plan that addresses the relapse, incorporating relapse prevention techniques and potentially adjusting the intensity or type of services. Fourth, maintain confidentiality while adhering to any reporting obligations if imminent danger is present. Throughout this process, the CASAC must remain client-centered, respecting autonomy and promoting engagement in recovery. This systematic approach ensures ethical practice and effective client care, in line with New York State CASAC regulations. Question 2. When evaluating a client presenting with persistent difficulties in concentration, memory recall, and emotional dysregulation following a period of prolonged heavy substance use, which of the following assessment strategies best aligns with the regulatory framework for CASAC in New York State to determine the long-term effects of their substance use? Option A. Conduct a comprehensive biopsychosocial assessment that includes a detailed substance use history, current symptom presentation, cognitive screening tools, and exploration of potential co-occurring mental health conditions, while also considering the client's social support system and functional capacity. Option B. Attribute all observed cognitive and emotional difficulties directly and solely to the substance use, without exploring other potential contributing factors or utilizing standardized assessment measures. Option C. Focus exclusively on the client's physical health status and any immediate medical concerns related to past substance use, without delving into their cognitive or emotional functioning. Option D. Rely solely on the client's self-reported current symptoms and their subjective experience of improvement since discontinuing substance use, assuming that all observed difficulties are temporary withdrawal effects. The correct answer is A. Conduct a comprehensive biopsychosocial assessment that includes a detailed substance use history, current symptom presentation, cognitive screening tools, and exploration of potential co-occurring mental health conditions, while also considering the client's social support system and functional capacity. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a CASAC to assess the long-term impact of substance use on a client's cognitive and emotional functioning, which can be subtle and complex. The counselor must differentiate between the direct effects of substance use, co-occurring mental health conditions, and general life stressors. Accurate assessment is crucial for developing an effective, individualized treatment plan that addresses the client's specific needs and promotes sustained recovery. Correct approach analysis. The correct approach involves a comprehensive assessment that integrates information from multiple sources, including client self-report, collateral information, with consent, and standardized assessment tools. This approach aligns with New York State's regulations for CASAC, which mandate thorough client evaluation to inform treatment planning. Specifically, 14 NICR Part 822 outlines the requirements for program services, emphasizing the need for individualized assessment of a client's physical, psychological, and social functioning. By considering the client's history, current presentation, and potential for long-term effects like persistent cognitive deficits or mood disorders, the counselor can develop a treatment plan that is evidence-based and addresses the multifaceted nature of addiction and its consequences. This holistic view ensures that interventions are tailored to the client's unique recovery journey. Incorrect approach is analysis. One incorrect approach would be to solely rely on the client's current self-report of symptoms without further investigation. This fails to acknowledge that individuals in recovery may minimize or be unaware of the full extent of long-term cognitive or emotional impairments due to substance use. It also overlooks the potential for co-occurring disorders that may be exacerbated by substance use. This approach is ethically problematic as it may lead to an incomplete or inaccurate diagnosis, hindering the development of an effective treatment plan, and potentially violating the principle of beneficence by not providing the most appropriate care. Another incorrect approach would be to attribute all observed behavioral or emotional changes solely to the substance use without considering other contributing factors. While substance use can have profound long-term effects, it is essential to rule out other medical or psychological conditions that might be presenting concurrently. This oversimplification can lead to misdiagnosis and inappropriate treatment, failing to address the client's full spectrum of needs. It also neglects the counselor's ethical responsibility to conduct a thorough differential diagnosis, as required by professional standards of practice. A third incorrect approach would be to focus exclusively on the physical aspects of substance use and neglect the significant psychological and social long-term consequences. Addiction impacts the brain's reward pathways, emotional regulation, and social functioning. Ignoring these aspects would result in a treatment plan that is incomplete and unlikely to foster sustained recovery. This approach would be a failure to adhere to the comprehensive assessment requirements mandated by 14 NICR Part 822, which necessitates an evaluation of a client's overall functioning. Professional reasoning. When faced with assessing long-term effects of substance use, professionals should employ a systematic and multidimensional approach. This involves 1. Active listening and empathetic engagement with the client to build rapport and encourage open disclosure. 2. Gathering historical data regarding the pattern, duration, and type of substance use. 3. Utilizing validated assessment tools and screening instruments designed to identify cognitive, emotional, and behavioral impairments. 4. Seeking collateral information from family members or previous treatment providers, with appropriate client consent, to gain a broader perspective. 5. Collaborating with other healthcare professionals, such as physicians or psychiatrists, when necessary to rule out or address co-occurring medical or mental health conditions. 6. Continuously monitoring the client's progress and adjusting the treatment plan based on ongoing assessment and feedback. This iterative process ensures that the treatment remains responsive to the client's evolving needs and promotes optimal recovery outcomes. Question 3. The audit findings indicate a discrepancy in the documentation of a client's substance use, with the counselor's notes primarily focusing on the client's expressed desire to stop using and the presence of withdrawal symptoms, but lacking a clear classification of the substance use disorder according to the DSM-5 criteria as required by New York State OSA's regulations. Which of the following actions best addresses this audit finding and upholds professional and regulatory standards? Option A. Focus solely on managing the client's immediate withdrawal symptoms and defer a formal diagnostic classification until the client is more stable. Option B. Update the client's chart to reflect the client's stated desire to quit and the observed withdrawal symptoms, as this is sufficient evidence of a substance use problem. Option C. Conduct a comprehensive reassessment of the client using the DSM-5 criteria to accurately classify the substance use disorder, ensuring all diagnostic elements are documented, and revise the treatment plan accordingly. Option D. Consult with the client's primary care physician to obtain their opinion on the client's substance use, as this external medical perspective will clarify the diagnosis. The correct answer is C. Conduct a comprehensive reassessment of the client using the DSM-5 criteria to accurately classify the substance use disorder, ensuring all diagnostic elements are documented, and revise the treatment plan accordingly. Explanation. The audit findings indicate a potential discrepancy in how a client's presentation is being documented and understood within the agency. This scenario is professionally challenging because it requires the counselor to critically evaluate their own diagnostic process and documentation against established professional standards and regulatory requirements for substance use disorders, as defined by New York State's Office of Alcoholism and Substance Abuse Services, OSA's, regulations. The counselor must balance the immediate needs of the client with the imperative of accurate and compliant record keeping. The correct approach represents best professional practice because it directly addresses the audit finding by initiating a review process grounded in the DSM-5 criteria, which is the standard for diagnosing substance use disorders under OSA's regulations. This approach ensures that the client's condition is classified accurately, leading to appropriate treatment planning and resource allocation. It also demonstrates a commitment to professional development and adherence to regulatory mandates for documentation and diagnosis, which are crucial for client care and agency accountability. An incorrect approach that relies solely on the client's self-report without further assessment or consideration of diagnostic criteria fails to meet the professional standard for diagnosis and documentation. This could lead to misclassification of the substance use disorder, resulting in inappropriate treatment interventions and potentially hindering the client's recovery progress. Ethically, it breaches the duty of care by not ensuring an accurate assessment. Another incorrect approach that focuses on the severity of withdrawal symptoms alone, without a comprehensive evaluation of the pattern of use, impaired control, social impairment, and risky use as outlined in the DSM-5, is also problematic. A withdrawal is a symptom. It is not the sole determinant of a substance use disorder classification. This narrow focus can lead to an incomplete or inaccurate diagnosis, impacting treatment efficacy and compliance with OSA's documentation standards. A third incorrect approach that prioritizes immediate symptom management over diagnostic accuracy risks overlooking the underlying disorder. While immediate stabilization is important, proper diagnosis is foundational for effective, long-term treatment. Failing to accurately classify the substance use disorder according to DSM-5 criteria, as mandated by OSAs, constitutes a regulatory and ethical failure in diagnostic practice and record-keeping. The professional decision-making process for similar situations should involve a systematic review of the client's presentation against the current diagnostic manual, DSM-5. This includes gathering collateral information, conducting a thorough biopsychosocial assessment, and applying the diagnostic criteria systematically. When audit findings or clinical observations raise questions about diagnostic accuracy, the professional should engage in a process of re-evaluation, consultation with supervisors or peers, and if necessary, revision of the diagnosis and treatment plan, ensuring all documentation aligns with OSA's regulations. Question 4. The assessment process reveals a client with a history of polysubstance use, including recent opioid and benzodiazepine dependence, who also reports significant symptoms of anxiety. Which of the following assessment strategies best aligns with the comprehensive evaluation requirements for a credentialed alcoholism and substance abuse counselor, CASAC, in New York State? Option A. Prioritizing the assessment of anxiety symptoms and developing a treatment plan for that, with a brief mention of substance use as a secondary concern. Option B. Relying solely on the client's self-report during a clinical interview to gauge the severity of both substance use and anxiety symptoms. Option C. Administering a validated screening tool for opioid use disorder and a separate validated screening tool for anxiety disorders, followed by a clinical interview to explore the interplay between the two. Option D. Utilizing a single, broad-spectrum screening tool that covers general substance use, but does not specifically address the nuances of opioid and benzodiazepine dependence or co-occurring anxiety. The correct answer is C. Administering a validated screening tool for opioid use disorder and a separate validated screening tool for anxiety disorders, followed by a clinical interview to explore the interplay between the two. Explanation. The assessment process reveals a client presenting with a complex history of polysubstance use, including recent opioid and benzodiazepine dependence, alongside significant co-occurring anxiety symptoms. This scenario is professionally challenging because it requires the counselor to move beyond simple identification of substance use to a nuanced understanding of the interplay between substance use and mental health conditions. Accurate and comprehensive assessment is paramount for developing an effective, individualized treatment plan that addresses both the addiction and the anxiety, ensuring client safety and promoting recovery. Adherence to New York State's regulations for CASAC, particularly those outlined in the Mental Hygiene Law and the regulations of the Office of Addiction Services and Supports, OSAs, is critical. The correct approach involves utilizing a multimodal assessment strategy that integrates standardized screening tools with clinical interviewing and collateral information, as mandated by OSA's guidelines for comprehensive client evaluation. This ensures that all relevant domains of functioning, including substance use patterns, mental health status, social support, and medical history, are thoroughly explored. This approach aligns with the ethical imperative to provide evidence-based and client-centered care, respecting the client's autonomy and promoting their well-being. It also directly supports the CASAC responsibility to accurately diagnose and plan treatment, according to established professional standards and regulatory requirements. An incorrect approach would be to solely rely on a single screening tool, such as the audit, without further clinical exploration. This fails to capture the full scope of the client's substance use, e.g., benzodiazepine use, and neglects the co-occurring anxiety disorder, leading to an incomplete assessment and potentially an inappropriate treatment plan. This violates OSA's regulations requiring a comprehensive assessment that addresses all presenting problems. Another incorrect approach would be to prioritize the anxiety symptoms over the substance use, or vice versa, without a balanced and integrated evaluation. This demonstrates a failure to adhere to the principle of treating the whole person and can lead to ineffective interventions for either condition. It also risks misdiagnosis and inadequate treatment, contravening the professional and ethical obligations of a CASAC. A further incorrect approach would be to make assumptions about the client's needs based on demographic information alone, without conducting a thorough assessment. This is discriminatory and unprofessional, violating ethical codes and OSA's regulations that mandate individualized assessment based on the client's specific presentation. Professional decision-making in such situations requires a systematic process. First, recognizing the complexity of the client's presentation. Second, identifying appropriate, evidence-based screening and assessment tools that are validated for the identified issues and align with OSA's requirements. Third, conducting a thorough clinical interview to gather qualitative data and explore nuances not captured by standardized tools. Fourth, considering collateral information, with client consent, to gain a broader perspective. And finally, synthesizing all gathered information to formulate a differential diagnosis and a comprehensive, individualized treatment plan that addresses all identified needs in accordance with New York State regulations. Question 5. Quality control measures reveal that a credentialed alcoholism and substance abuse counselor, CASAC, is under pressure from a referring agency to initiate treatment for a new client within 24 hours, despite the counselor believing a comprehensive biopsychosocial assessment requires at least 48 hours to complete thoroughly. Which approach best aligns with CASAC regulatory requirements and ethical best practices for conducting comprehensive biopsychosocial assessments? Option A. Focus primarily on the client's immediate substance use symptoms and request the referring agency to provide any available prior assessment information to expedite the process. Option B. Prioritize completing all essential components of the biopsychosocial assessment, including gathering collateral information and administering standardized screening tools, even if it means delaying the initiation of direct treatment services beyond the referring agency's initial 24-hour request, while communicating the rationale for the delay. Option C. Conduct a shortened version of the biopsychosocial assessment, focusing only on the most critical areas, and document that the assessment was abbreviated due to time constraints. Option D. Initiate treatment immediately based on the client's self-report and a brief screening, deferring the completion of the full biopsychosocial assessment to a later date once treatment has begun. The correct answer is B. Prioritize completing all essential components of the biopsychosocial assessment, including gathering collateral information and administering standardized screening tools, even if it means delaying the initiation of direct treatment services beyond the referring agency's initial 24-hour request, while communicating the rationale for the delay. Explanation. This scenario presents a common challenge in substance abuse counseling, balancing the immediate need for intervention with the ethical and regulatory requirement of a thorough, comprehensive assessment. The counselor is under pressure to initiate services, but rushing the biopsychosocial assessment can lead to misdiagnosis, inappropriate treatment planning, and ultimately, poorer client outcomes. The CASAC credential mandates adherence to specific standards for client evaluation, ensuring that treatment is tailored to the individual's unique needs and circumstances. The correct approach emphasizes the foundational importance of a comprehensive biopsychosocial assessment as the bedrock of effective treatment. New York State regulations for CASAC, as outlined in Part 853 of the Mental Hygiene Law and associated regulations, mandate that counselors conduct thorough assessments to understand the client's substance use history, mental health status, social environment, and physical health. This holistic view is critical for developing an individualized treatment plan that addresses all contributing factors to the client's substance use disorder and co-occurring conditions. Failing to conduct a complete assessment risks overlooking crucial information, leading to ineffective or even harmful interventions. An incorrect approach that prioritizes speed over thoroughness violates the spirit and letter of CASAC regulations. For instance, relying solely on self-reported information without collateral contacts or standardized screening tools, when indicated, would be a failure to gather sufficient data. This could lead to an incomplete understanding of the client's situation, potentially missing significant co-occurring mental health issues or social determinants of health that require specific interventions. Another failure would be to skip sections of the assessment that are deemed less critical in the moment, such as exploring family history of substance use or mental illness, or assessing for trauma, which are vital components of a biopsychosocial understanding. These omissions can result in a treatment plan that does not adequately address the client's underlying issues, thus failing to meet the client's needs and potentially leading to relapse or treatment failure. Furthermore, neglecting to document the assessment process thoroughly, including the rationale for any deviations or the limitations of the information gathered, would be a regulatory and ethical breach, hindering peer review and continuity of care. Professional decision-making in such situations requires a commitment to the client's well-being, guided by regulatory mandates and ethical principles. The counselor must advocate for the necessary time and resources to complete the assessment properly, explaining to supervisors or referring agencies the rationale for a comprehensive evaluation. This involves prioritizing the client's needs for accurate diagnosis and effective treatment planning over expediency. When faced with time constraints, the counselor should identify essential components of the assessment that can be initiated immediately, while planning for the completion of other crucial elements as soon as possible, ensuring that no critical information is permanently overlooked. Question 6. The assessment process reveals that a client in an outpatient substance use disorder program has a history of inconsistent attendance and difficulty maintaining abstinence between sessions. The CASAC is considering implementing contingency management strategies to improve engagement and adherence to treatment goals. Which of the following approaches best aligns with New York State CASAC regulations and ethical best practices for contingency management? Option A. Providing rewards for unrelated personal achievements, such as getting a new job or completing a household chore, regardless of treatment attendance or abstinence. Option B. Implementing a system where clients receive rewards only if they achieve perfect attendance and abstinence for an entire month, with no intermediate reinforcement. Option C. Offering small, tangible rewards such as gift cards for successful completion of weekly treatment goals, such as attending all scheduled sessions and providing a clean urine drug screen. Option D. Threatening to terminate the client from the program if they miss more than one session, using the threat of program removal as a motivator. The correct answer is C. Offering small, tangible rewards such as gift cards for successful completion of weekly treatment goals, such as attending all scheduled sessions and providing a clean urine drug screen. Explanation. This scenario presents a professional challenge because it requires the CASAC to apply principles of contingency management and reinforcement in a way that is both ethically sound and compliant with New York State regulations for credentialed alcoholism and substance abuse counselors. The core of the challenge lies in ensuring that reinforcement strategies are used to promote positive behavioral change without becoming coercive, exploitative, or undermining the client's autonomy, all while adhering to the specific guidelines outlined by the New York State Office of Alcoholism and Substance Abuse Services, OSAS. The correct approach represents best professional practice because it aligns with the principles of evidence-based treatment and ethical counseling as mandated by OSAS. Contingency management, when implemented appropriately, utilizes tangible rewards or privileges to reinforce desired behaviors, such as abstinence or attendance at treatment sessions. This approach is effective because it leverages behavioral principle to motivate clients who may struggle with intrinsic motivation due to the effects of substance use. The correct option focuses on providing positive reinforcement for demonstrated progress, such as negative drug screens or consistent attendance, which is a direct application of contingency management principles. This method respects client dignity, promotes self-efficacy, and is consistent with the goal of facilitating recovery. OSA's regulations emphasize client-centered care and the use of effective treatment modalities, which this approach embodies. An incorrect approach that involves withholding essential treatment services as a penalty for non-compliance would be a regulatory and ethical failure. OSAS mandates that clients have access to necessary services to support their recovery. Using treatment as a punitive measure, rather than a supportive one, violates this principle and can be seen as coercive. Furthermore, it undermines the therapeutic alliance and can lead to clients disengaging from treatment altogether, which is counterproductive to recovery goals. Another incorrect approach, such as offering rewards for behaviors that are not directly related to treatment progress or abstinence, e.g., unrelated personal achievements, would be a misuse of contingency management principles. While positive reinforcement is valuable, the focus in a substance use disorder treatment context must be on behaviors that directly contribute to recovery. This misapplication dilutes the effectiveness of the strategy and may not align with the client's treatment plan or OSA's guidelines for therapeutic interventions. A third incorrect approach, such as providing rewards that are disproportionately large or create an undue financial burden on the agency, could raise ethical concerns regarding resource allocation and potential for dependency on external rewards rather than internal motivation. While tangible rewards are part of contingency management, they must be practical, sustainable, and ethically managed within the agency's resources, and in accordance with OSA's fiscal guidelines. The professional decision-making process for similar situations involves a thorough assessment of the client's needs and readiness for change, followed by the development of a treatment plan that incorporates evidence-based interventions like contingency management. Professionals must consult OSA's regulations and ethical codes to ensure that any reinforcement strategy is implemented in a way that is client-centered, non-coercive, and directly supports the client's recovery goals. Regular evaluation of the effectiveness of the chosen strategy and adjustments as needed, in collaboration with the client, are crucial. Question 7. Compliance review shows that a credentialed alcoholism and substance abuse counselor, CASAC, is working with a client who presents with significant anxiety, auditory hallucinations, and paranoia, in addition to a history of heavy alcohol use and recent withdrawal symptoms. The counselor has primarily focused on developing a relapse prevention plan for alcohol use. What is the most appropriate next step for the counselor to ensure comprehensive and ethical client care? Option A. Advise the client to seek psychiatric evaluation independently and wait for the results before proceeding with any substance abuse counseling. Option B. Conduct a thorough screening and assessment for co-occurring mental health disorders and collaborate with other healthcare professionals as needed to inform the treatment plan. Option C. Continue to focus solely on the client's alcohol use disorder, assuming all other symptoms are directly related to substance intoxication or withdrawal. Option D. Document the client's symptoms as part of their substance use disorder, without further investigation into potential underlying mental health conditions. The correct answer is B. Conduct a thorough screening and assessment for co-occurring mental health disorders, and collaborate with other healthcare professionals as needed to inform the treatment plan. Explanation. Scenario analysis. This scenario presents a common challenge in substance abuse counseling where a client's presentation is complex, involving co-occurring mental health symptoms that may be exacerbated by substance use or are independent conditions. The challenge lies in accurately differentiating between primary substance use disorder symptoms and symptoms of a co-occurring mental health disorder, as well as understanding how these conditions interact. Misdiagnosis or an incomplete assessment can lead to ineffective treatment plans, potentially worsening the client's condition and violating ethical and regulatory standards for providing appropriate care. The counselor must navigate the nuances of symptom presentation to ensure a comprehensive and individualized treatment approach. Correct approach analysis. The correct approach involves a thorough, multifaceted assessment that specifically screens for and evaluates co-occurring mental health disorders. This aligns with best professional practice and regulatory requirements for CASAC in New York State, which mandate a comprehensive assessment that addresses all aspects of a client's health, including mental health. This approach ensures that the treatment plan is holistic, addressing both the substance use disorder and any identified mental health conditions, thereby promoting recovery and well-being. It reflects the understanding that substance use disorders often co-occur with mental health disorders, and that integrated treatment is most effective. Incorrect approach is analysis. One incorrect approach is to solely focus on the substance use disorder symptoms and attribute all behavioral and emotional changes to the intoxication or withdrawal. This fails to acknowledge the possibility of a co-occurring mental health disorder, which requires specific diagnostic and treatment considerations. Ethically and regulatorily, this is a failure to conduct a comprehensive assessment as required by New York State regulations for substance use disorder treatment providers. Another incorrect approach is to immediately assume a primary mental health diagnosis without adequately assessing the impact of substance use. This can lead to inappropriate medication or therapy that does not address the underlying substance use disorder, potentially leading to relapse or worsening of both conditions. This approach violates the principle of providing evidence-based treatment tailored to the client's presenting problems, including the substance use disorder. A third incorrect approach is to dismiss the client's reported symptoms as simply part of the addiction without further investigation. This demonstrates a lack of clinical curiosity and a failure to adhere to professional standards that require a detailed exploration of all presenting issues. It overlooks the potential for serious mental health conditions that require professional intervention beyond substance abuse counseling. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a comprehensive biopsychosocial assessment. This assessment should include detailed history-taking regarding substance use, mental health symptoms, family history, social support, and trauma. Standardized screening tools for both substance use disorders and common mental health disorders should be utilized. Collaboration with other healthcare professionals, such as psychiatrists or psychologists, is crucial when complex co-occurring conditions are suspected. The treatment plan should be dynamic and regularly reviewed, adapting to the client's evolving needs and responses to interventions. Adherence to the New York State Mental Hygiene Law and OSA's regulations is paramount in ensuring ethical and legal practice. Question 8. The assessment process reveals a client reporting recent and past use of alcohol, heroin, cocaine, and psilocybin mushrooms. Which of the following accurately describes the primary mechanism of action for each substance class, influencing the client's potential presentation and treatment needs? Option A. Alcohol primarily affects acetylcholine receptors. Opioids increase GABA release. Stimulants block dopamine reuptake. Depressants, e. Benzodiazepines increase norepinephrine levels. Hallucinogens, e.g., psilocybin, primarily interact with opioid receptors. Option B. Alcohol primarily enhances glutamate neurotransmission. Opioids increase acetylcholine activity. Stimulants reduce GABAergic activity. Depressants, e.g., benzodiazepines increase dopamine release. Hallucinogens, e.g., psilocybin, primarily affect NMDA receptors. Option C. Alcohol primarily enhances GABAergic neurotransmission and inhibits NMDA receptors. Opioids bind to mu-opioid receptors. Stimulants increase dopamine and norepinephrine release. Depressants, e.g., benzodiazepines, enhance GABAergic neurotransmission. Hallucinogens, e.g., psilocybin, primarily interact with serotonin 5-HT2A receptors. Option D. Alcohol primarily increases glutamate activity. Opioids block dopamine receptors. Stimulants reduce serotonin reuptake. Depressants increase acetylcholine activity. Hallucinogens, e.g., psilocybin, primarily affect cannabinoid receptors. The correct answer is C. Alcohol primarily enhances GABAergic neurotransmission and inhibits NMDA receptors. Opioids bind to mu-opioid receptors. Stimulants increase dopamine and norepinephrine release. Depressants, e.g., benzodiazepines, enhance GABAergic neurotransmission. Hallucinogens, e.g., psilocybin, primarily interact with serotonin 5-HT2A receptors. Explanation. The assessment process reveals a client presenting with a complex history of substance use, including reported use of alcohol, opioids, and stimulants. A CASAC must accurately identify the mechanisms of action for each substance to inform effective treatment planning, risk assessment, and psychoeducation. This scenario is professionally challenging because misinterpreting a substance's mechanism can lead to inappropriate intervention, potential harm to the client, and a failure to meet the client's specific needs. The correct approach involves accurately identifying the primary neurotransmitter systems affected by each substance and understanding how these effects manifest in the client's behavior and reported symptoms. For example, understanding that stimulants primarily increase dopamine and norepinephrine levels, leading to increased alertness and energy, while opioids primarily act on mu-opioid receptors to produce analgesia and euphoria, is crucial. Depressants, like benzodiazepines, enhance GABAergic inhibition, causing sedation and anxiolysis. Hallucinogens, such as LSD, primarily interact with serotonin receptors, particularly 5-HT2A, leading to altered perception. This detailed understanding aligns with the CASAC ethical responsibility to provide competent and evidence-based care, as mandated by New York State's regulations for credentialing and practice. It ensures that interventions are tailored to the specific physiological and psychological impacts of the substances used, promoting client safety and treatment efficacy. An incorrect approach would be to generalize the effects of substances or to rely on anecdotal information without understanding the underlying neurobiology. For instance, assuming all psychoactive substances cause euphoria or that all substances that alter mood are depressants would be a significant failure. This demonstrates a lack of foundational knowledge required for effective counseling and violates the ethical principle of competence. Another incorrect approach would be to focus solely on the client's subjective report without cross-referencing it with known pharmacological profiles, potentially leading to misdiagnosis or ineffective treatment strategies. This failure to apply scientific knowledge to practice is a direct contravention of the professional standards expected of a CASAC. Professionals should approach such situations by systematically reviewing the client's reported substance use, cross-referencing this information with established pharmacological knowledge of each substance's mechanism of action, and considering how these mechanisms might explain the client's presenting symptoms and behaviors. This involves a continuous process of learning and applying scientific understanding to clinical practice, ensuring that interventions are grounded in evidence and tailored to the individual's needs. Question 9. Cost-benefit analysis shows that addressing a client's acute anxiety symptoms related to withdrawal could significantly improve their engagement in therapy, but the counselor is aware that certain medications can have complex interactions with substances of abuse. Which of the following approaches best reflects the CASAC role and responsibilities in this situation? Option A. Suggests that the client temporarily increase their use of a previously abused substance that they report provides some relief from anxiety, as this may help them stabilize enough to attend therapy sessions. Option B. Advise the client to seek immediate medical attention and inform them that the counselor cannot provide any guidance on managing withdrawal symptoms due to the complexity of potential drug interactions. Option C. Recommend over-the-counter sedatives to the client, explaining that they are generally safe and can help manage acute anxiety symptoms, thereby improving their ability to focus on therapy. Option D. Collaborate with the client to explore non-pharmacological coping strategies for anxiety, while consulting with a physician to discuss potential medication options that are safe and appropriate for individuals with a history of substance use disorder. The correct answer is D. Collaborate with the client to explore non-pharmacological coping strategies for anxiety, while consulting with a physician to discuss potential medication options that are safe and appropriate for individuals with a history of substance use disorder. Explanation: this scenario is professionally challenging because it requires a counselor to balance the immediate need for symptom relief with the long-term goal of recovery and the potential risks associated with pharmacotherapy. The counselor must understand the client's current presentation, their history, and the potential impact of various substances on their cognitive and emotional state, which directly relates to pharmacokinetics and pharmacodynamics. Careful judgment is required to avoid making recommendations that could inadvertently exacerbate the client's substance use disorder or interfere with their treatment progress. The correct approach represents best professional practice because it prioritizes a comprehensive assessment of the client's needs and risks before considering any pharmacotherapy. This aligns with New York State's regulations for CASAC, which emphasize client-centered care, ethical practice, and the importance of understanding the biological and psychological aspects of addiction. Specifically, the counselor is expected to work collaboratively with the client, when appropriate, with other healthcare professionals to ensure that any medication recommendations are safe, effective, and integrated into a broader treatment plan. This approach respects the client's autonomy while ensuring their safety and well-being, adhering to ethical guidelines that prohibit practicing outside one's scope of expertise and mandate consultation when necessary. An incorrect approach that focuses solely on the client's subjective report of distress without a thorough assessment of their substance use history and potential drug interactions would be a regulatory and ethical failure. This could lead to inappropriate recommendations that might mask symptoms without addressing the underlying disorder or even precipitate adverse reactions, violating the principle of do no harm. Another incorrect approach, such as directly prescribing or recommending specific over-the-counter medications without consulting a physician or understanding their pharmacokinetic and pharmacodynamic properties in the context of the client's substance use, would constitute practicing medicine without a license, a clear violation of CASAC's scope of practice and New York state law. Recommending a substance that has a known potential for abuse or dependence, even if it offers temporary relief, without a comprehensive risk-benefit analysis and physician consultation, would also be an ethical and regulatory failure, as it could undermine the client's recovery goals. Professional decision-making in such situations requires a systematic process. 1. Conduct a thorough biopsychosocial assessment, including a detailed substance use history, current symptoms, and any co-occurring mental health conditions. 2. Understand the principles of pharmacokinetics, how the body processes a drug, and pharmacodynamics, how a drug affects the body, as they relate to common substances of abuse and potential therapeutic agents. 3. Identify potential risks and benefits of any proposed intervention, including pharmacotherapy. 4. Consult with relevant healthcare professionals, such as physicians or psychiatrists, when pharmacotherapy is being considered or is already in place. 5. Collaborate with the client to develop a treatment plan that integrates all aspects of their care, respecting their preferences and promoting their recovery. 6. Continuously monitor the client's response to treatment and adjust the plan as needed. Question 10. The evaluation methodology shows a counselor conducting a substance use assessment with a client from a different cultural background. The counselor is considering how to best understand the client's experiences and needs. Which of the following approaches best reflects culturally competent best practice for this assessment? Option A. Utilizing a standardized assessment tool while being mindful of potential cultural differences and adapting questioning to elicit culturally relevant information, and actively inquiring about the client's cultural beliefs and their connection to substance use. Option B. Making assumptions about the client's cultural norms and their impact on substance use based on general knowledge of their ethnic group, without direct client input. Option C. Focusing exclusively on the client's self-reported symptoms of substance use, disregarding any cultural explanations or contextual factors the client may offer. Option D. Administering a widely used, standardized assessment tool without modification, assuming its universal applicability across all cultural groups. The correct answer is A. Utilizing a standardized assessment tool while being mindful of potential cultural differences and adapting questioning to elicit culturally relevant information, and actively inquiring about the client's cultural beliefs and their connection to substance use. Explanation. This scenario presents a professional challenge because the counselor must navigate the complexities of cultural nuances that can significantly impact how a client expresses distress, their understanding of addiction, and their willingness to engage in treatment. Without a culturally sensitive approach, the assessment could be incomplete, inaccurate, or even alienating, leading to a suboptimal treatment plan. Careful judgment is required to ensure the assessment is both comprehensive and respectful of the client's background. The correct approach represents best professional practice because it prioritizes a client-centered, culturally informed assessment. This aligns with the ethical principles of the Credentialed Alcoholism and Substance Abuse Counselor, CASAC, credential, which mandates that counselors provide services in a manner that respects the dignity and worth of each individual. Specifically, New York state regulations and ethical guidelines for CASAC emphasize the importance of cultural competence, requiring counselors to be aware of and sensitive to the cultural backgrounds of their clients. This approach ensures that the assessment tool and process are adapted to the client's cultural context, allowing for a more accurate understanding of their substance use, its impact, and their readiness for change. It fosters trust and rapport, which are foundational for effective treatment. An incorrect approach that relies solely on a standardized, culturally generic assessment tool fails to acknowledge the diversity of client experiences. This can lead to misinterpretation of symptoms, underestimation of the severity of the problem, or the overlooking of culturally specific coping mechanisms or support systems. Ethically, this violates the principle of providing competent and individualized care. It also risks perpetuating biases and stereotypes, which is contrary to the CASAC Code of Ethics. Another incorrect approach that involves making assumptions about the client's cultural background without direct inquiry is equally problematic. This demonstrates a lack of cultural humility and can lead to significant misunderstandings. Ethically, it is a failure to gather accurate information and can result in a treatment plan that is irrelevant or even harmful to the client. It also disrespects the client's autonomy by imposing external interpretations. A further incorrect approach that dismisses the client's cultural expressions as irrelevant to their substance use issues is a direct contravention of best practices. Substance use is often deeply intertwined with cultural factors, including social norms, family dynamics, and historical experiences. Ignoring these connections leads to an incomplete and potentially ineffective assessment. Ethically, this approach fails to consider the whole person and the multifaceted nature of addiction, thereby compromising the quality of care. The professional decision-making process for similar situations should involve a commitment to ongoing cultural self-awareness and continuous learning. Counselors should actively seek to understand the cultural backgrounds of their clients, utilizing assessment tools and techniques that are culturally appropriate or adaptable. This includes asking open-ended questions about cultural beliefs, values, and practices related to health, illness, and substance use. When in doubt, it is always best practice to ask the client directly and respectfully about their cultural perspectives and how they relate to their current situation. Collaboration with supervisors or culturally competent colleagues can also provide valuable guidance. Question 11. The assessment process reveals that a client diagnosed with opioid use disorder expresses a strong preference for a spiritual healing modality that lacks empirical support for treating opioid addiction, while also acknowledging the need for structured support and relapse prevention strategies. As a credentialed alcoholism and substance abuse counselor, CASAC, operating under New York State regulations, how should you proceed in developing the treatment plan? Option A. Recommend that the client seek spiritual counseling separately and proceed with a treatment plan solely based on empirically supported pharmacological and behavioral interventions for opioid use disorder. Option B. Exclusively focus on evidence-based interventions like medication-assisted treatment and cognitive behavioral therapy, explaining to the client that their preferred spiritual modality is not recognized as effective by professional standards. Option C. Integrate the client's preferred spiritual healing modality as a primary component of the treatment plan, while also incorporating evidence-based interventions such as motivational interviewing and contingency management for relapse prevention. Option D. Agree to the client's request to solely pursue the spiritual healing modality, deferring to their wishes as the primary driver of the treatment plan. The correct answer is C. Integrate the client's preferred spiritual healing modality as a primary component of the treatment plan, while also incorporating evidence-based interventions such as motivational interviewing and contingency management for relapse prevention. Explanation. This scenario presents a common ethical and professional challenge for a CASAC, balancing a client's expressed preferences with the evidence-based treatment modalities that are most likely to be effective for their specific substance use disorder. The challenge lies in respecting client autonomy while upholding professional responsibility to provide care grounded in scientific efficacy, as mandated by New York State regulations for CASAC practice. The correct approach prioritizes integrating the client's expressed interest in a specific, non-evidence-based modality into a broader treatment plan that also incorporates empirically supported interventions. This aligns with New York State's emphasis on client-centered care, which requires counselors to collaborate with clients in developing treatment goals and plans. However, it also adheres to the CASAC ethical obligation to provide services based on current knowledge and best practices, ensuring that the client receives treatment with a demonstrated track record of success. This approach respects the client's voice while ensuring the plan is clinically sound and likely to yield positive outcomes, thereby fulfilling regulatory expectations for competent and ethical practice. An incorrect approach that solely focuses on the client's preferred, non-evidence-based modality without incorporating empirically supported interventions would be professionally unacceptable. This failure to integrate evidence-based practices risks providing ineffective treatment, potentially leading to poor client outcomes, and a violation of the CASAC duty to provide competent care. It also disregards the regulatory framework that expects counselors to utilize approaches with proven efficacy. Another incorrect approach, which dismisses the client's expressed interest entirely and imposes a treatment plan without any consideration for their preferences, would also be professionally problematic. While it might prioritize evidence-based practices, it fails to adequately address the client's autonomy and engagement in treatment, which are crucial for successful outcomes. New York State regulations emphasize a collaborative approach, and ignoring client input can lead to disengagement and resistance, undermining the therapeutic alliance. The professional decision-making process for similar situations should involve a thorough assessment of the client's needs, preferences, and readiness for change. Counselors must then critically evaluate the evidence base for various treatment modalities relevant to the client's presentation. The next step is to engage in a collaborative discussion with the client, explaining the rationale behind evidence-based practices and how they can address the client's goals. This discussion should also explore the client's interest in specific modalities, acknowledging their preferences while gently guiding them towards interventions with a higher likelihood of success. The final treatment plan should represent a synthesis of these elements, ensuring both clinical efficacy and client buy-in. Question 12. Operational review demonstrates that a client presenting for substance use disorder counseling has recently experienced a significant increase in social withdrawal, persistent low mood, and reports of auditory hallucinations, in addition to their primary substance use. The counselor has noted these changes over the past few sessions. Option A. Document the observed symptoms thoroughly. Discuss the potential implications with the client in a supportive manner, and initiate a referral to a psychiatrist for a comprehensive psychiatric evaluation to assess for co-occurring disorders. Option B. Advise the client that these symptoms are likely a direct result of substance withdrawal, and encourage them to focus on completing their detoxification program before seeking further help. Option C. Attempt to diagnose the suspected mental health condition based on the observed symptoms and begin providing direct mental health interventions without a formal referral or consultation. Option D. Continue focusing solely on the substance use disorder treatment plan, as the client's primary presenting problem is addiction, and address the other symptoms only if they directly impede substance use recovery. Correct answer is A. Document the observed symptoms thoroughly, discuss the potential implications with the client in a supportive manner, and initiate a referral to a psychiatrist for a comprehensive psychiatric evaluation to assess for co-occurring disorders. Explanation. This scenario presents a common yet complex challenge in substance use disorder counseling: the identification and management of co-occurring mental health conditions. The professional's responsibility extends beyond addressing the substance use disorder to recognizing and appropriately responding to potential psychiatric comorbidities, as mandated by the New York State Department of Health, NISDO, regulations governing CASAC practice. The correct approach involves a systematic and ethical process of assessment and collaboration. It requires the counselor to utilize their training to identify potential signs of a co-occurring disorder, document these observations thoroughly, and initiate a referral for a comprehensive psychiatric evaluation. This aligns with the ethical principle of beneficence, ensuring the client receives the most appropriate and integrated care. Furthermore, it adheres to NISDO guidelines that emphasize the importance of a holistic approach to treatment, recognizing that untreated mental health conditions can significantly impede recovery from substance use disorders. Collaboration with other healthcare professionals is also a cornerstone of effective co-occurring disorder treatment, as outlined in ethical codes and best practice standards. An incorrect approach would be to ignore or minimize the observed symptoms, as this violates the duty of care and could lead to suboptimal treatment outcomes. Failing to document observations or initiate a referral for further evaluation constitutes a breach of professional responsibility and potentially violates NISDO record-keeping requirements. Another incorrect approach would be to attempt to diagnose and treat the suspected mental health condition without the necessary qualifications or a formal referral, which could lead to misdiagnosis, inappropriate treatment, and harm to the client, and would exceed the scope of practice for a CASAC. Finally, failing to involve the client in the decision-making process regarding referrals or further assessment undermines client autonomy and the therapeutic alliance, which are critical for successful treatment. Professionals should approach such situations by first trusting their clinical judgment based on their training and experience. They should then meticulously document all observations, including specific behaviors, statements, and changes in functioning. The next step is to engage the client in a discussion about these observations, explaining the rationale for further assessment in a non-judgmental and supportive manner. Based on this discussion and the client's consent, a referral to a qualified mental health professional for a comprehensive psychiatric evaluation should be initiated. Throughout this process, maintaining open communication with the client and collaborating with other members of the treatment team are paramount. Question 13. Risk assessment procedures indicate a client who is currently in a counseling session expresses a clear and immediate intent to end their life within the next 24 hours, stating they have a plan and access to the means. The counselor has previously established a therapeutic alliance with this client. What is the most appropriate immediate course of action for the CASAC? Option A. Advise the client that due to the severity of their statements, the counseling session must end immediately, and they should seek help from a hospital emergency room on their own. Option B. Immediately initiate a safety plan with the client, including identifying support systems and coping strategies, while also consulting with a supervisor and preparing to contact emergency services if the risk assessment indicates imminent danger. Option C. Immediately contact emergency services and law enforcement to report the client's suicidal intent without further assessment or consultation. Option D. Assure the client that their confidentiality will be maintained and encourage them to promise not to act on their suicidal thoughts, trusting in the therapeutic alliance. The correct answer is B. Immediately initiate a safety plan with the client, including identifying support systems and coping strategies, while also consulting with a supervisor and preparing to contact emergency services if the risk assessment indicates imminent danger. Explanation: this scenario presents a significant professional challenge due to the immediate safety concerns for both the client and potentially others, coupled with the counselor's ethical and legal obligations to maintain confidentiality while ensuring client well-being. The counselor must navigate a complex situation where the client's stated intent to harm themselves directly conflicts with the duty to protect. Careful judgment is required to balance these competing demands in accordance with New York State regulations for credentialed alcoholism and substance abuse counselors, CASAC. The correct approach prioritizes immediate safety and adheres to the CASAC Code of Ethics and relevant New York State mental hygiene law provisions regarding duty to warn and protect. This involves a structured risk assessment, consultation with supervisors or appropriate authorities, and documentation of all actions taken. This approach upholds the counselor's responsibility to prevent harm, while respecting the client's rights to the greatest extent possible under the law. An incorrect approach that involves solely relying on the client's promise to not act on their suicidal ideation without further assessment or intervention fails to meet the legal and ethical standards for risk management. This would be a violation of the duty to protect, as it places undue trust in a client who is in acute distress and potentially lacks the capacity for sound judgment. Another incorrect approach, such as immediately calling emergency services without a thorough risk assessment or consultation, may be an overreaction and could unnecessarily escalate the situation, potentially damaging the therapeutic relationship and violating client privacy more than necessary, unless the risk assessment clearly indicates imminent danger. A third incorrect approach, such as ignoring the client's statements due to a desire to maintain confidentiality at all costs, is a direct violation of ethical and legal mandates when there is a clear and present danger of harm to self or others. Professionals should employ a decision-making framework that begins with a comprehensive risk assessment, including evaluating the client's intent, plan, means, and protective factors. This should be followed by consultation with supervisors or colleagues, and if necessary, involving appropriate external resources, e.g., emergency services, law enforcement, in accordance with established protocols and legal requirements. Documentation of the assessment, consultation, and actions taken is paramount. Question 14. Governance review demonstrates that a credentialed alcoholism and substance abuse counselor, CASAC, is working with a client who has been in stable recovery for 6 months. During a recent session, the client expresses increased stress from work and admits to experiencing intrusive thoughts about using substances, though they deny any actual use or cravings. The counselor is concerned about the potential for relapse. What is the most appropriate course of action for the CASAC to take, adhering strictly to New York State CASAC regulations and ethical guidelines? Option A. Engage the client in a discussion about their current stressors and intrusive thoughts, collaboratively reviewing and updating their relapse prevention plan to incorporate new coping strategies and support systems. Option B. Schedule additional, mandatory counseling sessions with the client to monitor their progress more closely and reinforce coping strategies. Option C. Advise the client that their recovery is showing signs of instability and suggest they take a break from counseling until they feel more stable. Option D. Immediately report the client's expressed thoughts to their employer and family, as this indicates a high risk of imminent relapse. Correct answer is B. Schedule additional, mandatory counseling sessions with the client to monitor their progress more closely and reinforce coping strategies. Explanation: this scenario presents a common challenge in substance abuse counseling, balancing client autonomy with the counselor's ethical and regulatory obligations to ensure safety and promote recovery. Professional challenge lies in recognizing the subtle signs of potential relapse while respecting the client's right to self-determination and avoiding paternalistic interventions. The counselor must navigate the gray area between providing necessary support and overstepping boundaries, all within the strict confines of New York State's CASAC regulations and ethical codes. The correct approach represents best professional practice because it prioritizes a collaborative, client-centered strategy that aligns with CASAC regulations regarding informed consent, client rights, and the counselor's role in facilitating recovery. By engaging the client in a discussion about their concerns and collaboratively developing a revised relapse prevention plan, the counselor empowers the client, strengthens the therapeutic alliance, and adheres to the principle of least restrictive intervention. This approach respects the client's agency in their recovery journey while proactively addressing potential risks, as mandated by ethical guidelines that emphasize client participation in treatment planning. An incorrect approach that involves immediately increasing the frequency of mandatory counseling sessions without client consent or a thorough discussion of the perceived risks represents a failure to uphold client autonomy and informed consent, which are fundamental ethical and regulatory principles. This approach could be perceived as punitive and may alienate the client, potentially hindering their engagement in treatment. Another incorrect approach, such as reporting the client to external authorities based solely on the counselor's subjective interpretation of potential relapse, would likely violate confidentiality regulations and could be an overreaction without sufficient evidence or a collaborative attempt to address the situation. A third incorrect approach, which involves withdrawing support or disengaging from the client due to perceived difficulty, is a clear ethical failure, as CASAC are obligated to provide ongoing support and guidance to clients in recovery. Professionals should employ a decision-making framework that begins with active listening and empathetic inquiry to understand the client's perspective and any contributing factors to their current state. This should be followed by a collaborative assessment of risks and strengths, leading to a joint development or revision of the relapse prevention plan. The process must be transparent, with clear communication about the rationale for any proposed interventions and respect for the client's input and decisions, always within the bounds of regulatory requirements and ethical obligations to ensure client safety and well-being. Question 15. Quality control measures reveal that a CASAC is consistently documenting treatment plans that focus exclusively on individual counseling sessions and medication management for clients with severe substance use disorders. While client case notes frequently mention significant family conflict, financial instability within the household, and reports of neighborhood-level drug dealing impacting the client's environment. What is the most appropriate and ethically sound approach for the CASAC to implement to address the broader impacts of substance use? Option A. Document the family and community issues in the client's file, but take no further action, as the CASAC primary responsibility is to the individual's direct treatment. Option B. Advise the client that family issues and community problems are outside the scope of individual substance use counseling and focus solely on the client's direct treatment goals. Option C. Directly intervene in family disputes and attempt to resolve neighborhood drug dealing issues independently to create a more stable environment for the client. Option D. Expand the treatment plan to include family engagement strategies, referrals to community support services addressing financial instability, and collaboration with local law enforcement or community outreach programs regarding neighborhood safety concerns. Correct answer is D. Expand the treatment plan to include family engagement strategies, referrals to community support services addressing financial instability, and collaboration with local law enforcement or community outreach programs regarding neighborhood safety concerns. Explanation. This scenario presents a common implementation challenge for CASAC, balancing the immediate needs of an individual client with the broader, systemic impacts of substance use on their family and community. The challenge lies in recognizing that effective treatment extends beyond the individual to encompass the interconnected web of relationships and social structures affected by addiction. A CASAC role, as defined by New York State regulations, specifically, the requirements for credentialing and ethical practice outlined by the Office of Addiction Services and supports OSAs, mandates a holistic approach that considers these broader impacts. The correct approach demonstrates best professional practice by acknowledging the multifaceted nature of substance use disorders and their consequences. It aligns with the ethical principles of CASAC practice, which emphasize client well-being, advocacy, and the promotion of healthy environments. By actively seeking to involve family members and community resources, the CASAC is not only addressing the individual's recovery, but also mitigating the ripple effects of substance use on those closest to them and the wider community. This proactive engagement is crucial for long-term recovery and for fostering a supportive ecosystem that can sustain sobriety. It reflects an understanding of the social determinants of health and the importance of community-level interventions, which are implicitly or explicitly supported by the principles guiding CASAC practice in New York. Incorrect approaches fail to meet the comprehensive standards expected of a CASAC. One incorrect approach might focus solely on the individual's immediate treatment needs, neglecting the significant impact substance use has on family dynamics, child welfare, and community safety. This narrow focus can lead to relapse, strained family relationships, and continued community disruption, ultimately undermining the long-term success of treatment. Such an approach would be a failure to adhere to the spirit and letter of OSA's regulations, which encourage comprehensive care. Another incorrect approach might involve overstepping professional boundaries by attempting to directly manage family or community issues without appropriate referrals or collaboration. This could lead to unintended negative consequences and a violation of ethical guidelines regarding scope of practice and professional competence. A third incorrect approach might be to dismiss the broader impacts as outside the CASAC purview, which is a direct contravention of the holistic and community-oriented principles embedded in the CASAC credentialing framework. This demonstrates a lack of understanding of the pervasive influence of substance use. A professional decision-making process for CASAC in such situations should involve a thorough assessment that includes not only the individual's substance use history and current status, but also an evaluation of their social support system, family relationships, and community connections. When significant impacts are identified, the CASAC should prioritize interventions that address these broader issues, which may include family counseling, psychoeducation for family members, referrals to community support groups, or advocacy for community-based resources. Collaboration with other professionals and agencies is often essential. This systematic approach ensures that all relevant factors influencing recovery are considered, leading to more effective and sustainable outcomes for the individual, their family, and the community. Question 16. Assessment of a client presenting for substance use disorder services in New York State requires a comprehensive understanding of various influences. Which of the following approaches best reflects the evaluation of risk and protective factors for substance use disorders, aligning with New York State CASAC regulatory framework and best practices? Option A. Focusing exclusively on the client's immediate environmental stressors and peer group influences, neglecting to explore personal resilience, coping skills, and access to community resources. Option B. Prioritizing the identification of genetic predispositions and family history of substance use as the primary determinants of risk, while overlooking individual coping mechanisms and social support systems. Option C. Emphasizing the client's past legal issues and employment history as the sole indicators of risk, without considering their current mental health status or aspirations for the future. Option D. Conducting a thorough biopsychosocial assessment that systematically explores individual, familial, peer, and community-level factors, differentiating between those that increase vulnerability to substance use and those that promote resilience and recovery. The correct answer is B. Prioritizing the identification of genetic predispositions and family history of substance use as the primary determinants of risk, while overlooking individual coping mechanisms and social support systems. Explanation. This scenario presents a common challenge for credentialed alcoholism and substance abuse counselors, CASAC, in New York State, accurately identifying and differentiating between risk and protective factors for substance use disorders, SUD, in a client. The challenge lies in the nuanced interplay of these factors, which can vary significantly based on individual circumstances, cultural background, and developmental stage. A CASAC must possess a deep understanding of these factors to conduct a comprehensive biopsychosocial assessment, which is a cornerstone of effective treatment planning under New York State regulation for substance use disorder services. The correct approach represents best professional practice because it demonstrates a thorough and individualized assessment of the client's unique situation. By considering a broad spectrum of potential influences, including family history, peer relationships, mental health status, and community resources, The CASAC is adhering to the principles of person-centered care mandated by New York State Office of Addiction Services and Supports, OSA's, guidelines. This comprehensive evaluation allows for the development of a tailored treatment plan that leverages protective factors and mitigates risk factors, thereby maximizing the client's potential for recovery. This aligns with the ethical obligation to provide competent and effective care. An incorrect approach that focuses solely on one category of factors, such as only external environmental influences or only internal psychological states, would be a regulatory and ethical failure. New York State regulations emphasize a holistic understanding of SUDs, recognizing that they are complex conditions influenced by multiple interacting factors. Failing to consider the full range of risk and protective factors would lead to an incomplete assessment, potentially resulting in an ineffective or even harmful treatment plan. This would violate the CASAC duty to provide appropriate care and could be seen as practicing below the expected standard of care as defined by OSAs. Furthermore, neglecting to explore the client's strengths and resilience, protective factors, while solely focusing on deficits, risk factors, can be disempowering and counterproductive to the recovery process. An ethical consideration in client engagement. The professional decision-making process for similar situations should involve a systematic approach to assessment. This includes actively listening to the client, utilizing validated assessment tools where appropriate, and considering the client's self-report alongside observable behaviors and historical information. Professionals should continuously ask themselves, what are the potential internal and external influences that might be contributing to or protecting against substance use in this individual's life? This iterative process of inquiry and analysis ensures that all relevant factors are considered, leading to a more accurate and effective intervention. Question 17. Comparative studies suggest that involving a client's family and support systems can significantly enhance treatment outcomes for substance use disorders. A credentialed alcoholism and substance abuse counselor, CASAC, is working with a client who has expressed a strong desire for privacy and has indicated reluctance to involve their family in their treatment. The CASAC believes that involving the client's family could provide crucial support and aid in the client's recovery. Under the regulatory framework for CASAC in New York State, what is the most ethically and legally sound approach for the CASAC to take in this situation? Option A. Obtain explicit, informed consent from the client before discussing any aspect of their treatment with their family or involving them in any treatment planning. Option B. Assume that the client's reluctance is a temporary phase and begin to include family members in sessions, explaining that this is a standard part of comprehensive treatment. Option C. Proceed with involving the client's family in treatment planning, as research indicates this generally leads to better outcomes, and explain the benefits to the client afterward. Option D. Inform the client's family about their substance use disorder and treatment progress to encourage them to offer support, even without the client's direct consent for this specific communication. The correct answer is A. Obtain explicit, informed consent from the client before discussing any aspect of their treatment with their family or involving them in any treatment planning. Explanation. Scenario analysis. This scenario is professionally challenging because it requires balancing the client's autonomy and confidentiality with the potential benefits of involving their support system in treatment. The counselor must navigate the client's expressed wishes against the recognized therapeutic value of family involvement, all while adhering to strict privacy regulations. This necessitates careful ethical reasoning and a deep understanding of client rights and the principles of substance abuse counseling. Correct approach analysis. The correct approach prioritizes obtaining explicit, informed consent from the client before involving their family. This aligns with the core ethical principles of autonomy and confidentiality, which are paramount in substance abuse counseling. New York State's Mental Hygiene Law (MHL) and the regulations governing CASAC e.g. 14 Nicker Part 80 emphasize client consent for the release of information and participation in treatment activities. Involving the family only after obtaining clear, voluntary consent respects the client's right to privacy and empowers them to control their treatment process, fostering trust and engagement. This approach also acknowledges that family dynamics can be complex and that forced involvement might be counterproductive or even harmful. Incorrect approaches analysis. One incorrect approach involves unilaterally deciding to involve the family without the client's consent, believing it is for the client's own good. This violates the client's right to confidentiality as protected by MHL and federal regulations like HIPAA. Though the question specifies CASAC regulations, the underlying principles of privacy are consistent, undermines client autonomy, and can lead to a breakdown of trust, potentially causing the client to disengage from treatment. Another incorrect approach is to proceed with family involvement based on a general assumption that all clients benefit from it, without assessing the client's specific situation, comfort level, or the potential impact on their recovery. This disregards the individualized nature of treatment planning and the importance of client-centered care, which is a cornerstone of ethical substance abuse counseling. It also fails to consider potential negative family dynamics that could hinder recovery. A third incorrect approach is to inform the family about the client's treatment without the client's explicit consent, even if the intention is to solicit their support. This is a direct breach of confidentiality and can have severe repercussions for the client's recovery and their relationships. CASAC regulations are clear on the necessity of consent for any disclosure of client information. Professional reasoning. Professionals should employ a decision-making framework that begins with a thorough assessment of the client's needs and readiness for family involvement. This includes discussing the potential benefits and risks of involving their support system, respecting their decision, and if consent is given, developing a clear plan for how and when the family will be involved. The process should be collaborative, client-driven, and always in compliance with New York State regulations regarding confidentiality and client rights. The counselor must continuously reevaluate the appropriateness and effectiveness of family involvement throughout the treatment process. Question 18. Strategic planning requires a CASAC to anticipate and prepare for critical client situations. During a session, a client expresses clear suicidal intent and details a specific plan to end their life within the next 24 hours. What is the most appropriate and legally compliant course of action for the CASAC to take immediately? Option A. Advise the client to contact a crisis hotline or seek help from a family member on their own. Option B. Immediately contact emergency services, e.g., 911, to report the client's imminent risk and request an immediate evaluation. Option C. Attempt to de-escalate the client's feelings and encourage them to promise not to act on their plan before considering further action. Option D. Consult with a supervisor for guidance on how to proceed before taking any direct action with emergency services. The correct answer is B. Immediately contact emergency services, e.g., 911, to report the client's imminent risk and request an immediate evaluation. Explanation. This scenario presents a common implementation challenge for CASAC, ensuring timely and appropriate referral to emergency services when a client's immediate safety is compromised. The professional challenge lies in balancing the client's autonomy and trust with the counselor's ethical and legal obligation to protect life and well-being. This requires swift, accurate assessment and decisive action within the established regulatory framework. The correct approach prioritizes immediate safety by directly contacting emergency services when a client expresses suicidal intent and has a plan. This aligns with New York State's mental hygiene laws and ethical guidelines for CASAC, which mandate reporting and intervention when there is a clear and imminent danger to self or others. The counselor's duty to warn and protect is paramount in such situations, superseding confidentiality when a life is at risk. This direct referral ensures the client receives the highest level of care and intervention necessary to prevent harm. An incorrect approach would be to delay referral by first attempting to de-escalate the situation without involving emergency services, especially when a plan is articulated. This could violate the duty to protect and expose the client to further risk. Another incorrect approach would be to solely rely on the client to seek help independently, as this abdicates the counselor's responsibility when immediate danger is present. Finally, consulting with a supervisor without initiating immediate emergency contact when a client has a suicidal plan and intent would be a failure to act promptly in a life-threatening situation, potentially leading to severe consequences and violating professional standards. Professionals should employ a decision-making framework that begins with a rapid risk assessment. If the assessment indicates imminent danger, e.g., suicidal ideation with a plan and intent, or immediate threat to others, the immediate priority is to activate emergency services. This should be followed by informing the client of the action being taken if feasible and safe, and documenting the incident and intervention thoroughly. Consultation with supervisors or colleagues can occur concurrently or immediately after the emergency referral is initiated, but should not delay the critical first step of ensuring safety. Question 19. To address the challenge of accurately assessing a client who reports a recent increase in their substance use, a credentialed alcoholism and substance abuse counselor, CASAC, must determine if this represents a transient pattern or a diagnosable substance use disorder according to the DSM-5. Which of the following assessment strategies best aligns with the DSM-5 criteria and CASAC practice standards for making this determination? Option A. Focusing exclusively on whether the client is experiencing withdrawal symptoms, as this is the most definitive sign of a substance use disorder. Option B. Systematically evaluating the client's reported substance use against all 11 DSM-5 criteria for substance use disorders, gathering detailed information on frequency, intensity, impact, and associated symptoms. Option C. Relying primarily on the client's statement that they are using more of the substance, without further detailed inquiry into specific behaviors or consequences. Option D. Immediately diagnosing a relapse or a new substance use disorder based on the single report of increased use, initiating a standard relapse prevention protocol. The correct answer is B. Systematically evaluating the client's reported substance use against all 11 DSM-5 criteria for substance use disorders, gathering detailed information on frequency, intensity, impact, and associated symptoms. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the counselor to differentiate between a transient period of increased substance use and a clinically significant substance use disorder, as defined by the DSM-5. Misinterpreting the client's presentation could lead to inappropriate treatment planning, potentially resulting in undertreatment or overtreatment, both of which can negatively impact client outcomes and the counselor's professional standing. The counselor must navigate the nuances of the DSM-5 criteria, considering the frequency, intensity, and impact of the substance use in the context of the client's overall functioning and history. Correct approach analysis. The correct approach involves a thorough assessment that directly applies the DSM-5 criteria for substance use disorders. This means systematically evaluating the client's reported substance use against each of the 11 diagnostic criteria. The counselor must gather detailed information about the quantity and frequency of use, cravings, time spent obtaining or using the substance, impaired control over use, continued use despite negative consequences, social or occupational impairment, hazardous use, and tolerance or withdrawal symptoms. This systematic, evidence-based approach ensures that a diagnosis is made based on objective criteria, aligning with professional standards and regulatory requirements for accurate assessment and diagnosis within the CASAC framework. This adheres to the ethical obligation to provide competent and evidence-based care. Incorrect approaches analysis. One incorrect approach would be to solely rely on the client's self-report of increased use without further investigation. This fails to meet the diagnostic rigor required by the DSM-5, as self-report can be subjective and may not capture the full spectrum of criteria indicative of a disorder. Ethically, this could be considered a failure to conduct a comprehensive assessment, potentially leading to misdiagnosis. Another incorrect approach would be to immediately assume a relapse or a new disorder based on a single report of increased use, without considering the duration, impact, or other DSM-5 criteria. This premature conclusion bypasses the necessary diagnostic process and could lead to unnecessary interventions or stigmatization, violates the principle of accurate diagnosis, and can be seen as a failure to exercise professional judgment based on comprehensive data. A third incorrect approach would be to focus only on the presence of withdrawal symptoms, neglecting the other 10 DSM-5 criteria. While withdrawal is a significant indicator, a diagnosis of a substance use disorder requires the presence of a pattern of problematic use leading to clinically significant impairment or distress, as evidenced by multiple criteria. Focusing on a single symptom without a holistic assessment is insufficient for diagnosis and deviates from the comprehensive diagnostic framework mandated by the DSM-5 and professional practice. Professional reasoning. Professionals should approach such situations by first recognizing the need for a comprehensive diagnostic assessment. This involves understanding the specific diagnostic criteria outlined in the DSM-5. The process should involve active listening to the client's narrative, followed by targeted questioning to elicit information relevant to each DSM-5 criterion. Documentation of this assessment process is crucial for accountability and continuity of care. When in doubt, consultation with a supervisor or a more experienced clinician is a vital step in ensuring accurate diagnosis and appropriate treatment planning, upholding the ethical responsibility to provide competent care. Question 20. The monitoring system demonstrates a client's inconsistent attendance at support group meetings and a recent increase in reported social isolation. As a credentialed alcoholism and substance abuse counselor, CASAC, operating under New York State OSA's regulations, which of the following approaches best addresses the immediate need for risk assessment and potential adjustment of the treatment plan? Option A. Rely solely on the counselor's professional judgment and past knowledge of the client's history to determine if a change in the treatment plan is necessary. Option B. Utilize a brief, general screening questionnaire that does not specifically address current substance use or relapse indicators to quickly gauge the client's overall well-being. Option C. Immediately increase the frequency of the client's individual counseling sessions without further assessment, based on the assumption that increased isolation indicates a worsening condition. Option D. Administer a validated screening tool for current substance use and relapse risk, followed by a clinical interview to explore the contributing factors to the observed changes and assess for any immediate safety concerns. Correct answer is D. Administer a validated screening tool for current substance use and relapse risk, followed by a clinical interview to explore the contributing factors to the observed changes and assess for any immediate safety concerns. Explanation. The monitoring system demonstrates a client's fluctuating engagement with treatment, presenting a professionally challenging scenario that requires careful judgment. The counselor must accurately assess the client's current risk level for relapse and potential harm to self or others, ensuring that interventions are tailored to their evolving needs. This requires a nuanced understanding of various screening tools and assessment methods, as mandated by New York State's Office of Addiction Services and Supports OSA's regulations for CASAC. The correct approach represents best professional practice because it prioritizes a comprehensive, multifaceted assessment that integrates validated screening tools with clinical observation and client self-report. This aligns with OSA's guidelines, which emphasize the importance of individualized assessment to inform treatment planning and ensure client safety. Utilizing a validated screening tool like the Audit C or DAS-10, followed by a more in-depth clinical interview and risk assessment, allows the counselor to gather objective data and subjective insights, leading to a more accurate determination of the client's current substance use disorder severity and associated risks. This approach ensures that treatment is evidence-based and responsive to the client's immediate needs, thereby promoting recovery and preventing relapse. An incorrect approach that relies solely on a single, brief screening tool without further clinical inquiry fails to meet the depth of assessment required by OSAs. This can lead to an underestimation of the client's needs or risks, potentially resulting in inadequate treatment planning and increased vulnerability to relapse. Another incorrect approach that solely relies on the counselor's subjective impression, without the support of validated instruments or structured assessment, risks bias and inconsistency, which is contrary to the professional standards of care and the requirement for objective documentation. Finally, an approach that focuses only on past history without current assessment overlooks the dynamic nature of substance use disorders and the immediate risks a client may be facing, failing to provide timely and appropriate support. Professional reasoning in such situations involves a systematic process. First, recognizing the need for reassessment due to observed changes in client behavior or engagement. Second, selecting appropriate, validated screening and assessment tools that are recognized by OSAs and relevant to the client's presentation. Third, conducting a thorough assessment that combines quantitative data from tools with qualitative information from clinical interviews and collateral sources if available. Fourth, synthesizing this information to develop a comprehensive risk assessment and individualized treatment plan. Finally, continuously monitoring the client's progress and reevaluating the assessment as needed, documenting all steps meticulously in accordance with OSA's record-keeping requirements.